Well, President Obama and the Democrats say they are ready to move forward with their plans to fix health care in America. That, in spite of the Republicans' call to scrap the current bill and just completely start the whole thing over. Last week's big summit didn't exactly change a lot of minds. So what's next from the Republican point of view? Louisiana Congressman Charles Boustany is here, and he's joining us now. He's a doctor. He was one of 3 doctors at the Health Care Summit last week, and we welcome you back to our program today. Before we begin and talk about health care, I do want to get your thoughts on Haiti. Well, we were talking about Haiti, of course, recently. Now we're talking about Chile and the 8.8 earthquake. Do you have anything to say about that?
Well, there's tremendous American generosity being lavished on Haiti to help out the folks there who are really struggling. And we will stand with the people of Chile as well to do what we can to provide assistance. This is truly a tragedy.
You say, moving on into the health care realm, you say most Democrats, independents, Republicans kind of agree on 80% on the solutions to bring down health care costs, but still, why are we having such a hard time getting any bill passed through?
Because this big mega bill is deeply flawed. Based on my 20 years of medical experience, I've looked at it very, very carefully. And it's really going to continue to keep the costs going up. It's on premiums. It's going to hurt us with regard to the deficit. It basically raids Medicare to build out a new entitlement, and there are a bunch of tax increases in the bill, nearly $500 billion. This is a real problem, and that's why I believe, along with the American people, that we ought to scrap the bill, and let's focus on those areas where we have agreement. We can go step by step and come up with some solutions that target problems, and keep an eye toward a comprehensive solution that will really bring down the cost for families and small businesses.
Conversely, though, you have Democrats saying, scrap the bill. What are you talking about? We've been working on this thing now for, a year. All of a sudden, we're going to be back where we were a year ago.
Well, I don't think that's necessarily true, because there are a number of ideas out there that have been really looked at. And look, the bottom line is the bill itself that has come out is deeply flawed. It was a partisan product crafted behind closed doors. We have some very good solutions, and I think a lot of our Republican solutions have broad agreement among independents and Democrats. The American people want us to scrap the bill and want us to get back to creating a real solution that brings down the cost for small businesses and for families, and that is, let's go step by step.
You talk to your constituents, obviously, on a frequent basis. What are the top concerns that they have?
Well, clearly seniors are very concerned about what these cuts in Medicare were going to do. I mean, because basically you're talking about cuts to hospice care, nursing homes, home health, and a whole host of other areas that will affect them. And they're seeing these reductions in Medicare being shifted over to create a whole new entitlement program. Clearly, seniors are very upset about this. I think business owners are very concerned about the tax increases in the bill. These are significant tax increases that are going to affect everybody at a time when we're in a serious recession. And so let's scrap the bill. Let's get back to some common sense solutions that really bring down the cost for families and small business owners.
You spoke at this conference and you said, look, no one likes dealing with paperwork. We all hate paperwork when it piles up and everything, but it's especially dangerous, and I underscore the word dangerous, you say, when you're dealing with doctors. Explain that.
Well, the thing is, it takes doctors away from patient care. And, the bottom line, again, is you want to do everything you can to foster doctor-patient relationships built on trust. And when paperwork sort of gets in the way, when you have to deal with insurance companies constantly who are hassling you in your office, you're not providing good patient care. And what the American people want is a good pathway to establish a doctor-patient relationship built on trust.
How does this bill add paperwork?
Well, this bill creates a number of reporting requirements that I think are going to be detrimental. And I think we can come to some broad agreements on how we can proceed to standardize some of this paperwork, use electronic means to communicate between insurance companies and doctors' offices and between doctors, because you have to avoid duplication if you're going to lower the cost. And so there are a number of things. Again, let me get back to it. A number of things that we agree on that we ought to go ahead and pass now. Let's do this incrementally. get some things done that will really make a difference immediately for American families and for small business owners in terms of bringing down the cost.
You were at that meeting. You think that's likely?
No, not at the rate we're going.
All right. Well,
you know, I think the administration and the Democratic leadership need to scrap the bill, and we can sit down and have a real discussion on how to proceed from there.
we'll end on a positive note, I guess, sort of. I was going for the Colts, but congratulations on your Saints.
Oh, thank you. Well, we're still very excited about the Saints.
I'm sure you are.
It's a tremendous thing for the state.
Good for you. All right. Thanks very much, Representative, for coming on and joining us today. Appreciate it.
Thank you, Juliet.
Have a good Sunday. Eric?
Oh, Juliet, there are some